Good morning. It's great to see you all here. When Dale called and asked if I would be willing to speak at the convention, he said, "We'd like you to do the keynote Friday night, but then is there something else you want to talk about?" And it didn't take too long for me to decide that I want to talk about the chemical abortion pill. This is something that is growing. It now takes up somewhere around 44%, or is the cause of 40 to 44% of all abortions in the United States. We are seeing abortionists getting older, dying, retiring, not being replaced. Places like the Planned Parenthood Center across the street are visible signs. You can drive by and say that's where the killing happens. So the abortion industry would be very happy to be able to just, send pills through the mail to a woman and nobody knows who's getting them and who's handing them out. So I think it's something, we are very familiar, being in the movement for years. We know about suction abortions, the DNC, the D&E, ripping the babies apart. We need to know more about this one. So that's why I said that I wanted to focus on this one process. Now, this was 21 years ago, it was 2000, the Washington Post admitted, and this is a quote, "Taking RU-486 isn't the trivial pop-a-pill medical procedure its enthusiasts have sometimes imagined. The full procedure requires a few trips to a doctor. Side effects include cramping and bleeding. 1 in 100 women will have bleeding severe enough to require surgery." Now, I don't think the Washington Post would print that today, but they were admitting that it's not just pop a pill, and yet that's where the abortion industry would like to take us. Some of them have even suggested over the counter. A woman can either pick it up or maybe have to go to a pharmacy. Like, I don't know if you get, Sudafed? I think you can only buy so much every 30 days, that they kind of control it. So, and you just go to the pharmacy and they'll give it to you, but they have to keep track of it. So that's kind of where they would like to go with this. So we need to know more about this growing procedure, which could soon eliminate many of the abortion facilities that are currently in existence. Now, for some years, the chemical abortion drug mifepristone, also known as RU-486, was being used to kill unborn children in Europe. The French manufacturer Roussel-Uclaf, which is how you get the RU-486, was trying to get it into the United States, but that effort was being met with strong resistance from the pro-life movement. In 1994, National Right to Life called for a boycott of all medicines brought into the country or produced by Roussel-Uclaf. They eventually abandoned production of the drug and gave the patent rights to the Pro-Abortion Population Council, which continued to do the trials on the drugs and pushed to get it legalized or accepted here in the United States. Now, in 2000, in the closing months of Bill Clinton's time in office, the FDA, Food and Drug Administration, approved distribution and use of RU-486 in the United States. I would say they finally caved to pressure. RU-486 is more commonly known now as mifepristone. It's a generic name, like aspirin or ketchup, that you can go to the counter, the shelf on the store, and, aspirin. Well, you've got a lot of different brand names. You go ketchup, there's a Hunt's, Heinz. So that's what mifepristone is. It's just kind of the generic name. The actual usual name, the brand name, is Mifeprix, but mifepristone is, I think, more commonly used, so that's what I'm going to do today. The abortion industry refers to these as medication abortions, but I think it's more a chemical abortion because it is a chemical that's being put into the woman's body to kill the baby. Mifepristone is one of 2 drugs used in early pregnancy chemical abortions. It blocks the effects of progesterone, which provides nutrients or nourishment for the baby as he or she is growing. So if you block the progesterone, in effect, you are drying up the nourishment, the nutrients, and the baby is almost like starving to death. It's kind of the effect. The second drug that is then taken a couple days later is misoprostol. It induces powerful cramps and extensive bleeding to expel the dead child. Now, because of the risks to women associated with mifepristone, the FDA put some fairly tight regulations. I don't know how tight they are, but on on the pill. It could be used up to 7 weeks. The woman would have to meet with the doctor or the abortionist who was prescribing the drug. She would take 3 pills of the mifepristone, it would be about 600 milligrams, right there at the abortion site. 2 days later, she would return to the abortionist and be given 2 pills of the misoprostol to induce the cramping. 14 days later, she would come back, so that was the 3rd visit, for an examination to make sure that everything has gone as it was supposed to. Now in 2000, and this was from 2000 to 2007 that they had put this in place. Now in 2007, Congress gave the FDA authority to place what are called REMS on certain drugs. And this is a quote from the FDA website. A risk evaluation and mitigation strategy, so it's the REMS, Risk Evaluation and Mitigation Strategy, is a drug safety program that the U.S. Food and Drug Administration can require for certain medications with serious safety concerns to help ensure the benefits of the medication outweigh its risks. While all medications have labeling that informs healthcare stakeholders about medication risks, only a few medications require a REMS, that strategy. To the chagrin of Planned Parenthood and others in the abortion industry, mifepristone was one of the few drugs that the FDA placed under the REMS list because of the potential danger it poses to pregnant women. In 2016, during the last year of pro-abortion President Obama's second administration, under pressure from the abortion industry, the FDA loosened its rules to allow greater and wider access to the drug. So here, the old labeling, you could use it through 49 days gestation, 7 weeks. They increased that to 10 weeks. So you could use the pills on older babies. Mifepristone, it was 3 tablets, the 600 milligrams. They reduced that to 1 tablet of 200 milligrams. Misoprostol was 400, and I'm not even sure what that UG is, 2 tablets at the healthcare provider facility. They changed it to 4 tablets, and you could take it at home. Okay, and one more. Post-treatment examination. The patients returned to the provider 14 days after taking the mifepristone. The new label said that patients are assessed 7 to 14 days later, not necessarily an in-person clinic visit. So you might get a call from the abortion facility saying, did you take the pills? Are you doing okay? Great, let us know if you have any complications. But there was no exam to make sure that, did she actually expel the baby? Was she still pregnant? So that was taken out. And then before, it was by or under the supervision of a physician who is authorized to prescribe the drug. They changed that to the supervision of a healthcare provider who is authorized to prescribe the drug. So nurse practitioners and physician assistants now had the ability to write the prescription for the drug. So are chemical abortions safe and effective, as we are often told? Not for Holly Patterson, Orianne Shevin, Rebecca Talberg, Manon Jones, Brenda Weiss, and many others. Holly Patterson was 18. The first time her father heard that she was pregnant and had taken the abortion pill was when he was called to the hospital and found her hooked up to a ventilator. She died later that day when a rare infection overwhelmed her body. Orianne Shevin was a 34-year-old attorney, a mother of 2. The same rare infection that killed Holly Patterson 2 years earlier took her life shortly after she used the same medication. Rebecca Talberg was a 16-year-old Swedish teen. She collapsed and bled to death in her boyfriend's shower after receiving the abortion pill at her local hospital. Manon Jones, a teenager from Britain who took the abortion pill, died on a gurney in a hospital hallway waiting for a transfusion. Brenda Weiss, a pharmaceutical representative from Chattanooga, Tennessee, died when an ectopic pregnancy missed by the abortion clinic ultrasound ruptured. Staff at the clinic thought she was just experiencing the normal cramps and bleeding that accompany a standard chemical abortion. Those are just a few of the names of the women who have died or suffered complications after using the abortion pill that is supposedly safe and effective. A 2018 document from the Food and Drug Administration shows that at least 24 known deaths in the U.S. have been associated with use of the abortion pill. There were nearly 100 ectopic pregnancies. Now, mifepristone blocks progesterone in the uterus, but it doesn't affect the fallopian tubes. So if the baby has not transferred from the fallopian tube to the uterus, she's taking these pills, but the baby is still in the fallopian tube, and that, of course, could cause her death if that ruptures. The FDA report also showed that thousands of others, have faced significant, potentially deadly, what they call adverse events or complications such as infections, hemorrhages, rupturing, ectopic pregnancies, and more. But new rules that require only the reporting of known patient deaths means we will likely never have an accurate record of how many women have actually been affected or how safe the drug actually is. Now, abortion pill promoters claim that more than 4 million women have used them safely. Well, it's obviously not safe for the 4 million babies who were involved in that process. Now, unfortunately, the number of chemical abortions is on the rise. We've gone from 1.6 million abortions in this country in 1990 to less than 860,000 a year. But chemical abortions have been steadily increasing and now account for, as I said, 40 to 44% of all abortions. The pill is a way to revitalize what would be a dying industry. Abortionists are getting older and retiring or dying, and not many younger doctors have been getting into the business to take over for them. However, if abortion pills are easier to dispense, if you can just hand them to the woman or even mail them to her, there will be more OBGYNs willing to get involved and do that for their patients. It is more accurate, though, to talk about the women who survived its use than successfully aborted. The women experience enormous pain and intense cramping, heavy bleeding that may last for weeks, or passing large clots, nonstop vomiting, and much more. We hear stories from women about the trauma they experienced when they found or saw the body of their very small baby in the toilet or on the shower floor as they were showering that morning. One woman wrote that she had gone through she'd had 2 abortions. One was surgical, the second was the medication, as she called it, the chemical abortion. She said the chemical abortion was much more painful and much more traumatic, that was the one that really affected her. And these are stories of women who supposedly successfully aborted. Sometimes the pills fail. As mentioned earlier, they do not work in circumstances of ectopic pregnancies. It is dangerous to take the pills without first having an ultrasound to see where that baby is located. Is the baby actually in the uterus? Now, 2 to 7% of patients will need a surgical procedure because the pregnancy did not completely pass from the uterus or surgery to stop the bleeding. If the FDA acknowledges that 7 to 14% of the women will need a follow-up surgery, that's 1 out of every 14 women that take the pill. It's difficult to say the process works. There is, of course, additional risk for the woman if she does need two abortions, the pill and then the follow-up surgical procedure to complete the process. Large numbers of the women do not return to the clinic. They do not respond to calls, or they're just lost to follow-up. So again, there's really no way of knowing how many of them have suffered complications or how they are doing. Severe complications start after the woman has left the abortion clinic. It may be days later, or she may actually live a couple 100 miles away. She may go to her personal doctor. She may go to an emergency room. She very likely was told that if you have severe complications, if you are bleeding, go to the emergency room and tell them you had a miscarriage. They can't tell the difference. So they are not going to be reporting that there was a problem with the medication or chemical abortion. Only the most severe complications are reported and maybe dealt with at the abortion clinic, but they aren't going to readily provide that information either. Reporting of most complications is no longer required to the manufacturer or the FDA, as I said, giving a very false impression of how safe this drug actually is. Now, despite garnering a large share of the abortion market, the abortion industry fights against any safety measures placed on the pills. An ultrasound can tell the age and location of the baby. If the abortion pill fails, surgical abortion is the backup method. But these abortionists, the advocates for abortion, will fight against these requirements. They don't want to have to do the ultrasound. They don't see the need for surgical training. Well, duh. If you're going to have to do the surgical abortion because the pill failed, you better know how to do them. But they aren't interested in that. They want to just hand her the pills and tell her to go home. They've chafed at dosages, numbers of visits, gestational limits. The first pill was too expensive. As I said, they went from 3 to 1. And they said, well, that's too much for the women, so that's why they reduced that first pill. But then they increased the pills that would cause the cramping and the expelling of the baby. So that's where she is having the severe cramps, the bleeding, because they increased those pills to reduce the cost of the process overall. They changed the time limit from 7 weeks to 10 weeks. But again, the abortionists, actually some of them have been prescribing it after the 10 weeks. They're getting into the older babies. They don't like paperwork involved. You have to order the pills. You have to certify that you understand how the pills work, what the risks are. They don't want to have to do that. They want to be able to sell them at pharmacies or make them available online. So women can just place the order, take the pills, and supposedly no one will ever know. The abortionists started the telemed abortions. Rather than meeting the abortionist in person, a pregnant woman sits in a Planned Parenthood office in one city, talks to the abortionist, he pushes a button on his computer, a drawer opens in the room where she is seated, she takes the pills, and he'll tell her to take the other ones at home. That wasn't easy enough for them. They wanted to make it even easier. They want to skip the meetings and just, are you pregnant? Okay, here are the pills. They really are trying to make it as easy as taking an aspirin. Now, we did crimp their plans in several states, as several of them passed legislation to require the abortionist to examine the patient in person before the abortion drug is prescribed. As the number of abortionists decreased, wait a minute. Anyway, okay, South Dakota is one of the states, congratulations, that actually did put those regulations in place, that the abortionist does have to meet with the woman. He does have to do an exam. As the number of abortionists have decreased due to retirement, lack of age scandal, lack of business, I mentioned Gosnell last night, there's just not a lot of interest for these abortionists wanting to get into it. So they really do want to reduce the standard of care, make it much easier for them. They wanted to skip all the patient testing and exams. Now, the industry has used COVID as an excuse for a temporary suspension. There was a lot of pressure on the FDA during COVID to remove all the limits that they had placed on abortionists and the abortion pill. Javier Becerra, who was Attorney General of California at the time, was leading the charge. He is now our Director of Health and Human Services in Washington, D.C. They wanted to get rid of the face-to-face meetings. They wanted to allow pills sent to the women through the mail. The FDA complied. They lifted the regulations, and they said, well, it's temporary. It's for the pandemic. But the industry is pushing hard to make those changes permanent. Now, all the moves by the abortion industry have made their intentions clear. It's not making abortion safer. Their own studies show chemical abortions to be almost 4 times more likely to send a woman to the emergency room than a surgical abortion. It's making abortion easier and more profitable. A chemical abortion, particularly if done at home, means less clinic space, less staff, and abortionists' time isn't, as required. More abortions can be done in less time, less clinic mess, and the abortionists make more money. The abortionist might have a short 5-minute video chat with the woman, but he doesn't have to deal with the blood and the mess of a surgical procedure, doesn't have to encounter the horror of her mutilated body. We have heard the stories, of course, from the abortionists who have come out talking about what they have seen during those surgical abortions. And they don't have to, look the woman in the eye as they tell her she's doing fine. They probably don't take calls in the middle of the night. The woman's going to go to the ER room instead. It's much easier for them. Now, clinic safety regulations, checking the patient's age on an ID, performing an ultrasound, letting the woman see her unborn baby, their job just gets easier as long as she's got a credit card. The abortionists never have to be in the same room as the woman, and that's just fine with them. They don't care about her. More than once, activists have pointed to the telemedical and do-it-yourself chemical abortions as a way to keep the business humming if and when Roe v. Wade is overturned. This can be something that's underground. It's harder to take care of. These are clearly their intentions for mifepristone, but we're not going to just roll over and let them do it. We're not going to let them destroy the lives of these women, or of course the babies. And part of what I want to share with you today is the hope that is out there, a process that has been going on now for 14 years. It's abortion pill reversal. As I said, the first drug, mifepristone, is meant to kill the baby by starving her of the nutrients. The second drug causes the cramping to expel the baby. If a woman takes that first set of pills and then she starts like, what did I do? I don't want to kill this baby. I made that decision because I was being pressured into it, my boyfriend, my husband, my parents, a friend, whatever. And she's thinking, I don't want to do that anymore. She can, if she acts quickly enough, reverse the process. We know that there are babies alive because it has worked. The woman needs to seek help from someone familiar with the process, of course. She begins the progesterone regimen when it's, the progesterone is what's being starved by the mifepristone. So she takes an extra heavy dose of progesterone under the care of a doctor who knows what he or she is doing, and it would reverse the effects of that mifepristone. And the regimen, the progesterone that she is taking, will likely continue through at least the first trimester. Now, progesterone is a natural hormone produced by the ovaries. It is used in some pregnancies when there is fear or reason to believe that there might be a miscarriage or a premature birth. It is an effort to restore that progesterone. Now, the two doctors that pioneered this process have both spoken at the National Right to Life Convention to talk about their experience and how it works. The first doctor to perform this abortion pill reversal process was Dr. Matthew Harrison, and the first woman that he treated was in 2007. Her baby would now be 13, maybe 14 years old. The second doctor that was involved with him in pioneering this whole process was Dr. George Delgado, who used it, and for his first success was in 2009. And he spoke at our convention like 5 or 6 years ago. The process has a 64 to 68% success rate. But how successful has it been? Now this is actually an old slide, and I apologize for that. I should have changed it before I sent it over here to the church. Thank you for doing this. But APR has now saved more than 2,500 lives. It works. States have added abortion pill reversal to their state-informed consent laws, requiring abortion facilities to inform a woman prior to or soon after taking the drug that the chemical abortion may be possible to reverse if she changes her mind. And I know South Dakota is one of the 13 states that does that. Dale was giving me a little more information yesterday. He said that when the woman is given the pills, she has to be given a sheet of paper along with it that says, if you change your mind, here's what you can do. You may be able to reverse the process. Now, the abortion industry is furious. This is junk science. They do not want it used. They will not promote it. They deny that it's possible. Now, I don't know how you can say 2,500 lives doesn't happen because they're there. The president of Planned Parenthood says that these states passing these laws, quote, are peddling dangerous medical information in their ongoing attempt to ban abortion. Well, if it's working, how can it be dangerous, and how can it be junk science? You know, like look at the 2,500 kids and tell them that it doesn't work. Look at the 2,500 mothers and tell them that it doesn't work. We know that it does. Abortion pill reversal, initiated by Doctors Delgado and Harrison, has been passed on to Heartbeat International. They have, of course, a great network, pregnancy support centers all over the world. So they have taken on abortionpillreversal.com. If you go to that website, there will be a number that you can call. It's a 24/7 hotline. And they will tell you that if you take that first pill, you have to get some action within the first 72 hours. Earlier is better. If you can do it after the first 24 hours, if it's within a day, your chances are going to increase the earlier that you take the reversal, the progesterone process. I think we need to help. I mean, they've already got, they say 1,000, more than 1,000 healthcare providers. But if you know of pro-life, I would say doctors, nurses, but especially OBGYNs who are going to be very familiar with all of this, I would suggest just talk to them. And are you familiar at all with the abortion pill reversal process? Would you be willing to have more information? Would you be willing to look at this process and maybe at least consider getting involved? Because if a woman in South Dakota takes the pill, calls the hotline, it would be very helpful if they could tell her, you know what, there's a doctor just down the street or 50 miles away. We can hook you up and get you connected. So I would encourage you, this isn't something that you just start, blasting every doctor you know. But if you've got those, especially the pro-life OBGYNs, talk to them and at least ask them to consider it. And then they can get in touch with Heartbeat or go to this website and make those connections as well. The more doctors we have willing to help with this process, I think even that would, the more babies we can save. National Right to Life has a fantastic education director. His name is Dr. Randy O'Bannon, and everything that I told you this morning came from him. He does a lot of research and follows all the studies and the paperwork and everything that's being done. So I would also encourage you that if you want more information, if you want specifics, if you want updates, I'm going to tell you how to go. And it might sound a little convoluted, but if you just follow it, I think you'd be easy to find. Our website is nrlc.org. And if you pull that up, there's going to be a ribbon of a few different options there. One of the top ones is going to say, Stay Informed. If you click on that, the very first one you would see is National Right to Life or NRL News Today. Click on that. And there's a little search button up on top. I would just say type in O'Bannon. It's O''Bannon. And articles that Randy has written would show up then. And most of his articles, quite frankly, have been on RU-486, the chemical pills, the drugs. He's also got a lot of great information on Planned Parenthood. But you can find out that information if you want more on anything I said today, or if I said something that didn't quite make sense or you're not quite sure what I said, go check it out. Randy will have all that information for you. Along with legislation and other initiatives, we must continue our efforts to educate the women who are considering abortion, of course, but also people who tend to think that this would be the way to go. It's the safe, easy way. We need to reach more and more people with undisputable facts that these children, no matter how young or how small, are members of the human family that deserve protection. The abortion industry may change tactics in an effort to kill even more babies, but the truth doesn't change, whether it's a suction abortion, D&E, or a chemical abortion. Every abortion kills an innocent human being and harms the mother. Thank you very much for your time.